Okay, First Lady, you're live.
Okay, thank you. Hello, everyone, and welcome to another installment of our Ask an Expert series. October is Pregnancy and Infant Loss Awareness Month. This is a time to reflect on the pain of losses, to honor the lives of these precious children, and to come together like we are today to share resources to support moms and their spouses. Today's panelists will not only answer questions, but share their own experiences with loss. As you'll hear shortly, there are different types of loss that can occur: miscarriage, stillbirth, and infant loss. Since day one, maternal and infant health has been a priority for our administration. And that's why the 2023 fiscal year budget includes $60 million towards Nurture NJ's programs and initiatives, dedicating $100,000 to develop a stillbirth prevention public campaign. This funding is integral to combating and raising awareness about pregnancy and infant loss. One quick note for those of you joining us online, if you think of any questions during our interview, please feel free to drop them in the chat. And if we have time, we will do our best to answer them towards the end. Okay, so now I am thrilled to welcome our experts and begin our discussion. With us today is Debbie Haine Vijayvergiya, founder of the 2 Degrees Foundation. Stillbirth advocacy was not part of Debbie's master plan, but on July 8th of 2011, her life irrevocably changed the moment her daughter Autumn was born still. Autumn's tragic death impacted her family greatly and propelled her mom toward helping others through advocacy. Debbie has since become a powerful stillbirth activist at both the state and the national level, a speaker, a writer, and a policy enthusiast. Over the past 11 years, she has been working tirelessly to give Autumn's short life a purpose and to shed light on this heartbreaking maternal health issue. In 2013, Debbie co-founded the National Action for Stillbirth Awareness and Prevention Coalition. The mission of the ASAP Coalition is to raise stillbirth awareness, unify voices, and accelerate prevention efforts in the United States. That same year, Debbie assisted in drafting New Jersey's first ever stillbirth legislation, which was passed in 2014. Welcome, Debbie. Also with us is Dr. Barbara Ostfeld, a professor in the Division of Neonatology, Department of Pediatrics at Rutgers Robert Wood Johnson Medical School, and program director of the SIDS Center of New Jersey, which she personally helped to establish in 1987 to address the need for research, education, and bereavement support. Her research on sudden unexpected infant death contributed to past and current American Academy of Pediatrics policies to address risk factors. For her work, she was named a champion for children by the American Academy of Pediatrics New Jersey chapter. Throughout her career, Dr. Ostfeld has worked with families facing loss and instructed healthcare providers and clergy in the provision of bereavement support. She is a member of the International Aaron Matthews SIDS Research Guild of Seattle Children's Hospital, the New Jersey State Medical Examiner SIDS Autopsy Protocol Committee, and the New Jersey Perinatal Quality Collaborative Health Disparities Work Group. And she has served as content expert on numerous state and national initiatives. Welcome to my friend, Barbara.
Thank you.
Next, we have Dr. Thomas Westover, the Chief of Maternal and Fetal Medicine and Perinatal Genetics at Capital Health. Before joining Capital Health, Dr. Westover was an attending physician at Cooper University Hospital in Camden, New Jersey for 26 years. He has held several academic appointments during his career, most recently serving as Associate Professor of OBGYN and Maternal Fetal Medicine at Cooper Medical School, Rowan University. He is a member of the American College of Obstetrics and Gynecology, the Society of Maternal Fetal Medicine, the New Jersey Maternal Fetal Medicine Society, and the International Society of Ultrasound in OBGYN. He is currently the co-chair of the New Jersey Hospital Association statewide perinatal safety collaborative. Dr. Westover is also a member of the New Jersey Department of Health's Maternal Mortality Review Committee. Welcome, Dr. Westover. Next up is Vu-Ann Foster. She serves as the Count the Kicks ambassador for New Jersey and is on multiple committees surrounding perinatal health and infant mortality, including the New Jersey Maternal Care Quality Collaborative with the New Jersey Department of Health. As a pre-eclampsia survivor and a lost mama, she is committed and dedicated to making a difference and improving maternal child health outcomes. Welcome to my friend Vu-Ann. Our next expert is Louis Magrone. Louis and his wife Francine faced an unthinkable loss and a lack of resources after losing their baby Joseph Louis during the third trimester in early 2017. Determined to help other parents in the same situation, they decided to turn their grief into action. Their organization, Walk in Sunshine, assists parents financially and spiritually who have lost young children. The not-for-profit provides financial assistance to New Jersey families grieving the loss of a child and supplies online resources for families worldwide. Welcome, Lou. And finally, I would like to welcome Yvelisse Gonzalez, a program manager of the Emotional Wellbeing Program at the Partnership for Maternal and Child Health of New Jersey. She has been working in the field of maternal and child health for 15 years, 13 of those years working with women suffering from postpartum depression. She has spoken to professionals and consumers on the topic of postpartum depression and ways for women to take care of themselves after the birth of a baby. She is familiar with the New Jersey legislation on postpartum depression screening and education and is dedicated to making sure that professionals and consumers are aware of it as well. Okay, so welcome to each and every one of you. Of course, if I missed anything in your biography or your background you want to share, please feel free to expand as we get through our Q&A. With that, I would like to get to our first question, which is going to be for Dr. Westover. Dr. Westover, it's important to note the different types of loss that can occur, miscarriage, stillbirth, or infant loss, and I'm wondering if you can walk us through what each of those different losses mean. Oh, you're muted.
Sorry about that. Traditionally, the losses have been defined by how far along you are in the pregnancy. So if you are under 20 weeks gestation, we consider that miscarriage. If you're over 20 weeks gestation, all the way up through birth, that's considered a loss is considered a stillbirth. And then obviously infant loss is described in either the newborn period, which we call that the neonatal period. That's the first 4 weeks of life. And then post-newborn or kind of infancy loss after that first 4 weeks, which would be an infant loss. So those are kind of the four kind of traditional criteria. They're defined by timing related to the pregnancy. And timing is relevant and important, but really much more important is the categories or the reasons why, the etiologies why the loss has occurred. And that can be genetic, environmental, placental issues, a host of different kind of different reasons why the placenta can fail during the pregnancy, and then a different set of reasons why a child can be lost during infancy. I think you're on mute now.
So thank you so much, Dr. Westover. I really appreciate that. And you can always tell when you have a pro in the house because they take something that's very complicated and they are able to dispel the myth in a few words and make it very basic. So I think I'd now like to ask a question of each of Lou, Debbie, and Vu-Ann. During visits with your doctor, how did you address any fears, questions pre or post pregnancy about the possibility of pregnancy or infant loss? Lou, maybe you can start us out there.
Yes, thank you, First Lady Murphy. Really, great to be here and that you're shedding light on a topic so important to us. I think what sticks out in my mind was at the time we were told our baby was going to be born still, and then those first couple weeks after that. So I thought that was an extremely critical point where I had questions that you know, I felt could have been answered a little bit better at that time. Some of those questions included, do we have a perinatal pathologist in New Jersey? Do we have, how do we arrange transportation? What it was Friday night at 5 p.m. When is your morgue open or closed? Unfortunately, those questions were not able to be answered. And we chose to bring our son Joseph, who was born still, to CHOP because I was not aware of some of the amazing panelists that we have here. Nobody knew in our situation what was available at Rutgers or nearby medical centers. So I looked at it at that point, and then I guess that was kind of the genesis of starting Walk in Sunshine, was because I know when you're sitting there Googling, trying to find control and me playing the dad figure, and we're waiting for this horrible event to happen. And then to get through that first couple of weeks, Google wasn't my friend, and maybe because I wasn't in the right headspace. So we founded Walk in Sunshine to be able to put books, blogs, podcasts, anytime that any physician like the talented ones here have a loss, they could say there might be something for that family, and wanted to, with the power of the internet and how we're so reliant on that, wanted to just be a positive force. So that time of loss is something I think about, and what is inspiring, my wife and I to try to form change here in New Jersey.
Thank you, Lou. Debbie?
Oops, sorry. For me, after suffering, I had already suffered 2 near fatal postpartum complication. I had 2 miscarriages. And then when Autumn was stillborn, I was chock full of anxieties and, fears myself. For me, information is power. And so I got informed. And so, like Lou said, going on the internet is not always the best thing. But what we did do was we decided to, have an autopsy and have placental examination, and we found out why Autumn had died. And so that we had that information moving forward with the subsequent pregnancy, what our best course of action would be. As far as doctor visits and all of that, I also chose to stay with the same doctors. The same team that I had wanted to be as committed to having me have a healthy baby. And I was very fortunate because I know that's not always the case. And so I think it was important for me to have that connection and have them understand what had happened and have a clear line of communication and to be closely monitored. And they were able to provide all of that for me. And so that's how I got through it. So thank you.
Thank you. Thank you, Deb. All right, Vuann.
Thank you. So in my 2 pregnancies that ended in loss, I was a bit native. I just didn't know. However, for my pregnancy, which resulted with a healthy baby boy, I did my research prior. I was equipped with the most effective ways to treat incompetent cervix diagnosis, which is what I've been diagnosed with after my pregnancy loss, which includes a trans-abdominal cerclage, progesterone suppositories, and biweekly cervical length checks. I demanded this treatment plan. Even when I was met with pushback, I pushed back with statistics for the treatment plan I was requesting versus in the treatment plan which was offered to me. I also felt like I had tried it the doctor's way with my daughters, and this pregnancy with my son, I realized that I needed to be a partner in my care to prevent another pregnancy loss. I also, another important piece to the puzzle is, a lot of women leave their providers after having multiple losses, and I didn't. I met with my providers in their office, not at bedside, to address, the concerns I had regarding my last pregnancies. And because of the education I provided those providers, they now know how to treat women with my condition, which is incompetent cervix, to prevent multiple pregnancy losses.
Listen, God bless you all. I can't thank you enough for sharing those stories. And again, the strength and the promise that you have in New Jersey that you're leaning in to try and help others is really beyond compare. So I thank you so much All right, the next question is going to be for Dr. Westover. Dr. Westover, we know that pregnancy loss can impact anyone, even the most prepared mom, but how can moms monitor their body and their baby throughout pregnancy to watch for any potential warning signs?
Right. So it's a great question, and has to do, I think, two separate issues. One is kind of patient knowledge or empowerment or engagement, and then the patient's ability to engage and hopefully have a positive relationship with their clinician who's ever taken care of them. So the first is obviously health, right? So you want to present into the pregnancy in the best health that you can and address any kind of underlying health issues that you may have prior to the pregnancy. The next would be to maintain good health practices during the pregnancy. Obviously, there's a whole host of things that are done in prenatal visits. And obviously, we want the patient and their family, their partner, their extended family to have the ability to interact and have a positive discussion, positive relationship with their clinicians. And then the patient needs to be aware of the types of things that might make them, might be a sign that they're developing a complication during pregnancy. Headaches, chest pain, abdominal pain, swelling, fever, shortness of breath, decrease in the baby's movements, bleeding. There's a whole host of different reasons. There's a whole industry dedicated to, kind of knowing what to expect when you're expecting in terms of both literature, online, in paper, et cetera. But I think it all comes down to trying to have the most knowledge you can, and hopefully having a positive, supportive relationship with whatever clinical team is taking care of you.
Thank you, Dr. Westover. Health and awareness, those are two good things. And you're absolutely right about that entire industry. So we can pursue that at another time. I guess our next question is for Eve and for Vuan. Stillbirth is disproportionately experienced by mothers of color. How can policymakers best assist medical professionals to ensure equal medical treatment and avoid loss of life due to racial discrimination? Eve, you want to start?
Hi, everyone, and good afternoon. Once again, it's my pleasure to be amongst all of you. So there's a couple different answers that I came up with. I have a long list, but in the interest of time, I won't go into a lot of detail. But for number one, for me, I think we need to work at improving access to medical care for everyone. Everyone should have the same access to preventative testing and screening, regardless of color, regardless of socioeconomic status. The ability to pay should have nothing to do with the quality of care that mom and baby are going to receive. The other thing I think that's important is teaching our women of color tools that they need to be able to advocate for themselves, especially with the healthcare system. What is the language that can be used? One of the things that we try to do a lot at the partnership is sort of, say, if you're not comfortable with what your provider is saying to you, or if you are not understanding what your provider is saying to you, to have the tools needed to find your voice and express those concerns to your provider. If you feel that your provider is not keeping you in the loop with anything, advocating for yourself and having them be able to do that with you. Another part is for providers to listen to these clients that they're working with. If the client is feeling that something is not right, whether it's physically, emotionally, and they're coming to their provider and sharing that, it's having the provider listen and treat each patient on an individual case, and I think that that's so important, and which is something that's been the message getting across with the whole Hear Her campaign, which I think is fantastic. And then the other thing is, funding home visitation programs, which is already starting to be done in the state of New Jersey, and, just doctors being aware of the resources that are available in the community to be able to pass that along to these patients that they're working with, for whatever it is that they need, whether it's a support group to deal with the loss, whether it's a mental health referral, but being aware of what is available to them in the community, and also know which ones take insurance, which ones don't take insurance, and working with the patient to be able to get them the level of care that they need and the level of care that they deserve. So those would be my top suggestions.
Okay, Vuan, that I guess you're up to bat. Let's see if you
Yes,
can.
so I second a lot of what Eve says. Policymakers can best assist medical professionals by putting laws in place that provide access to preventive screenings and treatment. So as of right now, women who are diagnosed with incompetent cervix, we will have a loss or multiple losses before we receive the treatment and care that we need, as insurance companies deems these screenings unnecessary as they are not needed for the majority. However, without the screening, it is less likely for you to be diagnosed, which will result in a loss or multiple losses. Screenings and effective treatment plans not only prevent a loss or multiple losses, but avoid lengthy and costly NICU stays. When necessary screenings or treatment plans are denied, this leaves women and families with two options: pay with cash or forgo the treatment or care that you need, which only widens the racial disparities. Lastly, policymakers can endorse stillbirth prevention campaigns like Count the Kicks, which provide educational tools, resources, and an app that assists and improves conversations between patients and providers regarding education surrounding fetal movements.
Thank you both so much for all of those resources. I have to say, I'm hearing a consistent theme, and it's not the first time I've heard it, which is having access to resources and knowing that the resources are literally there are two different things entirely, and we are constantly pushing back on that challenge. So thank you for sharing some of those resources. Dr. Westover, I'd love to turn back to you for a moment and ask, if a mother should have a stillbirth, does that increase or decrease her chances of having a second stillbirth down the road?
Right, it's a great question. It's a comment and a question that we get all the time, and unfortunately, there's not a simple answer because it relates to the etiology for why the first stillbirth occurred. So there are some things that are kind of lightning bolts out of left field. And thankfully, lightning doesn't strike twice as a general rule. And so some things are literally kind of random events in Mother Nature on our planet, and they will not recur. But to the best of our ability, we need to try and figure out why the first loss occurred. And I think we need to spend the effort on trying to understand why that loss occurred, as well as trying to support the patient and their family through that loss. So if you understand why something happened, then you're obviously better able to try and prevent that from happening again in the future. And I would suggest that we should really have two separate kind of processes in place across New Jersey. One would be to have every hospital, every maternity hospital and birthing center in the state have some type of stillbirth evaluation order set in place in their electronic medical record. The American College of Obstetrics has such a protocol. We just have to make sure it's implemented in all the maternity hospitals, and also then have a perinatal bereavement care plan in place for all of those maternity units as well too. So you have to kind of know why something happened in order to know the potential for recurrence, or if any intervention should be put into place to try and prevent any recurrence from happening again. And obviously, we still want to try and prevent the first occurrence as well too, but it depends on the underlying etiology as to how likely that is to happen.
So Dr. Westover, I know that my team is listening here and we're taking notes. That's not the first time I've heard you say that. So let's hope that we can move the needle a little bit more here in New Jersey. Okay, so turning to you, Dr. Ostfeld. While each story of loss is different, I wonder what might be some shared emotional challenges of early loss, and correspondingly, what ways there might be to support families as they cope.
Well, thank you, Tammy. Today, I'm speaking both in my professional capacity, but also as a parent who experienced early losses many years ago. In fact, today happens to be what would have been the 48th birthday of one of the two children that I lost. In my case, a cause was identified, a rare, fatal, and still incurable disease. But I think it's critical to appreciate that A hallmark of these early losses is that they are deaths that are often lacking an identifiable cause, and that only adds to the grief. And the first word out of the mouth of every grieving parent is why. And without answers, parents will search for one forever. And if answers aren't known, there's also understandable fear, just as we were talking about, that accompanies future pregnancies. Will it happen again? So to me, a major support must be what I'll call societal. Basically, what you, Tammy, as New Jersey's First Lady, and all of us on the call today involved in programs are doing. It's about 35 years ago that we received support from the New Jersey Department of Health to establish the SIDS Center of New Jersey, SIDS, Sudden Infant Death Syndrome, a leading cause of infant mortality. And it addresses a death that by definition has no known cause. So we were able to conduct research that contributed to the development of the American Academy of Pediatrics risk-reducing guidelines. And our education programs have kept New Jersey's rates among the lowest of all states. And our bereavement program provides much needed support, very specific support for weeks, months, or even years. We need more of these kinds of programs. We need specific ones focused on each type of loss. Even though there are shared aspects, the unique circumstances matter too. And being with people who have shared your journey, being with people who are further down the road in that journey, that's invaluable. And the second point I want to make is that families tell us all the time about the isolation that they feel. These deaths occur to young families. I was young when mine happened. You all are still young. Friends may be just as young, and they may pull back because what happened raises their own anxiety, or because they're not sure what to do to help. And we may pull back too as parents because it could be very painful to be around another family's baby. Or well-intentioned people may try to diminish the loss. Thank goodness it was just a baby. You'll have another. Oh my. The truth is, grief isn't known by the length of a life. When we dream about having a baby, we've already constructed their future, and now it's gone. The critical gift that friends and family can provide is actually very simple and yet very difficult. And that is to be present and listen, because parents need to tell their stories over and over again. But, and here's the problem and the challenge, listening to somebody in pain is very hard. We want to find the magic words to fix it. This is my message. There are none. Being present, stepping up, listening, that is the magic.
Barbara, first of all, no words on today being the 48th birthday. I'm sorry, I had not realized, and I thank you.
I feel that he said, go for it, Mom, participate, share.
Well, thank you. There's no question each of you are truly going for it, and I am so glad that you're doing that again. So based off of what Barbara has just said about listening and being present, I wonder if I can switch to Vuan and Debbie and ask you what advice you might have for other new parents or pregnant moms who might be concerned about infant loss or just need some reassurance in general to get over anxiety if they have either themselves had experienced that or had someone else. And similarly, is there anything more that a provider could do or could share with a mom as they are pregnant, or if they've already experienced loss? So Vuan, why don't you kick us off this time?
Sure. So knowledge is power. One thing we do at Life After Two Losses is we're teaching women and families and communities how to be your own advocate. And that's what's really got me through my third pregnancy, which I almost died from preeclampsia because I was not being listened to time and time again after showing up, expressing I'm having these symptoms, I just had a baby. So the importance of, just being your own advocate. I would also say to dedicate a designated family member who knows your wishes and who can advocate for you in the event that you cannot advocate for yourself. That is very important. I would also speak to what providers should do to support a mom who experienced the loss. So I would say start by validating her feelings, practice active listening when she has a concern, and not with the mindset, I'm the provider, I know best, but have the mindset that this is a partnership. Together, we are going to bring you and your baby out on the other side. I think that's very important. And yeah, that's it.
I agree with everything that you just said, Vuan, wholeheartedly. A few other things that I just would add is that, I think for someone who is expecting, and I guess they could even have had a loss, I was say newly expected parents, I think it's really important to connect with your doctor and feel like you have the same mindset and that you can find comfort in them and that you because there may be some uncomfortable, difficult conversations, and you want to know that you are of the same mindset. I think that's very, very important. I think that, the getting to know your baby and tracking movement is very important because, as Vuan said, and as I said before, like, knowledge is power, information is power. When you can go to your provider with some concerns, it's really helpful to know exactly, what the trend that your baby, how it has changed, and so that you can talk confidently about what your concerns are and what you think is going on. I'm also a huge fan. Listen to your gut. I think it's really important. We know our body's best, we know our baby's best. And so I think that it's really important that while there is always within a normal range of a situation, that if something doesn't seem right or feel right, say something. And, in hopes we'd like to think that the medical provider will listen. I also think that as far as someone who has experienced a loss and is pregnant, again, I think it's really important to just be kind to yourself. I think that, it's totally normal and okay to be afraid. That is something there is such a stigma associated to stillbirth that we don't talk about it. And so a lot of families are forced to suffer in silence, like I was. I hid my pregnancy until I couldn't hide it anymore. I didn't tell anyone about it because I was so afraid, and no one really talked to me about Autumn after she died. And so it really did force me to, go through this journey by myself. And so I think it's really important to be kind to yourself and acknowledge that, you're going through something and that it may not be the way in which you envisioned it, but that it's your journey. And I think it's really important to, again, have a provider that you connect with. I think it's important to have a support system. And I would just like to add, as far as providers who are there with families who have suffered a loss, I think something that we don't do enough is providers need to do a better job of really reassuring families and moms that it's not their fault. I think we carry a great deal of blame in these types of situations. I think that, making themselves available to talk with the family at any point and validating their feelings and being patient. And I just have to throw in, because I know everyone here would agree, it's really important for medical professionals to encourage any form of perinatal pathology and autopsy, placental examination, because without these types of examinations, we don't understand why their baby died, and we can't really understand why all these other babies are dying. It's this information that is so critically important. So instead of providers suggesting that we're not going to find anything out, we actually do. And it's really, really important that we have that information, because we cannot begin to prevent these losses without understanding why they are occurring. So thank you.
Thank you both. We always say it's so important to listen to the moms, and thank you for that. I wonder if I might just follow up with a couple more questions, which you've touched on some of this already, but I'm wondering how you personally coped after your loss, and what was your support system like, and were there any resources that you might recommend in the healing process for others? Either of you?
I can start.
Okay, thanks, Van.
No problem. So after my 2 pregnancy losses, I visited several different pregnancy infant loss support groups to cope with my loss. And I noticed the format of the grief support really only led us to continue to relive our loss experience over and over, which only fuels like depression and anxiety instead of providing like the empowerment we needed to get back to a place so we can live with the loss healthily. I realized also that a number of other women and families, especially women of color, were silently hurting in isolation that could truly benefit from having a community to not only grieve, but to heal. So it was through my experience, I learned that what good grief support should look like. And for me, it should be free, easily accessible, and not limited to just women and mothers, and empowering. So I have founded Life After 2 Losses, and one of the services we provide is grief support, which is we do virtually. I also provide support, via text or phone calls or through social media. And our model is unique as we spend only a small portion of time sharing our experience and the remainder of our time developing skills to learn how to get back to a place where we can live with the loss healthily.
As far as how did I cope, I did not cope well. I don't know how one can cope after a loss, like having a stillborn baby. And unfortunately for me, I lost Autumn 11 years ago. There weren't that many resources available. And I think that's what was so challenging for me. I could not find a support group that meshed well. And to what Luann said, it didn't feel quite right personally for me it became more stressful. I also couldn't find a therapist that could help me. And so that is probably what propelled me down this path of advocacy, because I wanted to try to make it better for other people, because it was a really not a great situation for me. I started the 2 Degrees Foundation because I wanted to give every family a fighting chance against stillbirth here in New Jersey. And, that has been extremely healing for me. And that is how I realized I've been able to cope, is to take my energy and, my grief and try to help other people through that so they don't have to suffer a similar fate. And so leap into action.
Yeah, and I can second that as well. I am similar to what you're doing. A lot of the work that I do is so that no family will ever have to go through some of the heartache that I've went through.
I think that's a universal sentiment that you each have expressed and are taking action on. Lou, I was going to ask you how spouses and family members and friends might support a mom who's lost a baby, but baby that you lost was Joseph Lewis. So I think it's probably a pretty fair statement to ask how you would like to have been helped and what you found best for you.
Sure, thank you. So many of the stories and mementos shared today ring true for all of us. And what Deb and Vuan and Dr. Ostfeld and Dr. Westover have said, I wish I knew about count the kicks before, just simple knowledge. And that's something that could be put out there, as well as finding an answer for why it happened. And for us and for Joseph, we have no answer. And so that obviously creates a ton of anxiety moving forward. So getting that answer and getting that data and getting it to the partnership and allowing New Jersey to source it and work with that data and then make an action plan moving forward would be amazing. But we can't do that if we don't have that, if that placental testing and autopsy is not performed. I think as the dad or the supporting significant other, 3 things I think about is understanding for the mom, holidays and important dates, the baby's due dates, Mother's Day, any other holiday that may have been important, Halloween, Christmas, Hanukkah, they are most likely not going to want to celebrate or not do what they did or break tradition, maybe not be around people, and that's okay. And to accept that we're going to break this 20-year tradition because this year is different. Honoring and being respectful to that is something I've learned. The other thing for support would be if there are living children, those living children are maybe not getting attention. It's a difficult time for everyone. So being able to help and take those other kids to the park or engage them with schoolwork would be amazing and helpful to the mom. And I think that the last piece is understanding that grief is staggered between the mom and the significant other most of the time. So that the mom is sitting here and myself as the dad, I'm trying to be the rock and to support her. But I'm not dealing with my own grief. So only as the mother is turning the page, now I start to accept and realize and allow and go through my grief. And now our timing is off as a couple because of the of where we're both at in this journey of grief. So that delayed grief that sometimes that significant other feels is something that I thought was worth sharing and for people to be aware of. So thank you again.
Thank you. Thank you so much. Thank you so much, Lou. Appreciate that. By the way, Vuan, nice to see King Cairo has made his appearance. So good.
Sorry, he was crying.
He's gotten so big. Okay, so we're running out of time, but I want to quickly ask one. I want to ask Eve if you can just tell us quickly what your partnership resources might be and anything you quickly want to give us on that before I do maybe one last question and we close it out.
Oh, no problem. So at the Partnership for Maternal and Child Health, through our emotional well-being program, there's quite a few different things that we do. So currently we do have a perinatal loss support group that meets bi-weekly. Usually it falls on the second to fourth Thursday of the month from 6 to 7 at night via Zoom. And one of the remarkable things that's with this cycle of the group is that the facilitators have a lot of couples. So it's been a great opportunity for the men and women to come together and to talk about their grief as a couple. And then, so that's been a wonderful thing. Another thing is we have what's called an emotional health phone support program. So anybody that suffers of a perinatal loss, they can get referred to our program and they're assigned to a perinatal mental health coordinator that will get them connected to whatever mental health resources that they need, whether it be in a group, a therapist, etc., whatever it is that they would need to feel better. The third part that we do at the partnership is we have what's called the Fetal Infant Mortality Review Program. So any losses that occur at 20 weeks or higher are contacted by our femur manager, who is Candace, and she will reach out to them, check in with them, and then she will, if the parent consents, she will do an interview to find out what happened. And then the last thing that we did, which is something that we did for the first time this year that we're hoping to do annually, is our program did have a day of remembrance that occurred during this month. And in the Day of Remembrance, we had it at a beautiful Victorian house in Montclair. We invited all of our families that attend our perinatal loss support group, as well as those who have consented to the femur interviews. And it was just a beautiful day for families to remember their babies. We had activities, we provided them with lunch. We had a tree that we drew where they were able to write little messages to the babies and put it on the tree. And it was just such a beautiful healing day. And that's something that we've never done before that we are looking to go forward and make it an annual thing. So yeah, that's a lot of what we do at the partnership.
Thank you. Thank you for that. We really have run out of time, but I want to quickly go and give each of you 30 seconds. If each of you can just tell me if there's one thing you want to make sure people remember. I know, Barbara, I wanted to ask you about COVID and the national forums you've been attending and themes, but let me just quickly go buzzer around, starting on my screen. Debbie, you're up first. Barbara, you're next.
Oh my God, 30 seconds isn't long enough, but let's go really quickly. If you have experienced a loss, I think it's really important. There is a fiercely committed community on Instagram and TikTok of lost moms. I didn't have that, and it's absolutely beautiful. And if you're in need of support, go there and you will find them. And just remember that you are not alone. It may feel that way, but you're not, and we are all here to support you. So you can always find me. I'm on Instagram at Stillborn Still Matters, or you can follow me at Shine for Stillbirth. And thank you again, First Lady, for having us here today, and to everyone that is here. I appreciate all that you do.
Barbara.
Well, 30 seconds. I think Lou mentioned the importance of expanding the support network. Mom, obviously critical participant, but it is a family that's going through this. And for example, at the SID Center, services for siblings, programs for siblings, grandparents, all who are affected. Everybody is going to experience the tragedy, and everybody is going to be anxious to move forward and help with the next baby, but that grieving process really has to involve everyone. And the other thing that I wanted to mention is that we cope, but we never really outgrow our grief. Every so often I will get an email, a text from somebody in their 70s, recently in their 80s, telling me that they heard about the SID Center. We get the referrals immediately, but that they had this in their history. They were a 5-year-old and their sibling died and so forth. They never spoke about it. The approach was never discussed. Take away all pictures. It didn't happen, or we can't discuss it. But it doesn't go away. And when we have conversations with those families, the relief that they feel being able to connect to others and being able to tell their story is powerful. It's a powerful moment for the people listening and for the person telling the story. So if you ever encounter people who have experienced such a loss years ago, just the systems were not set up for coping, but they still feel that need, it's never too late. It makes a difference. Refer them.
Dr. Westover.
Hi, thank you for doing this. Yes, I've mentioned two things that I think we need to do to create appropriate surveillance and assessment tools across the state. But I think we need to not accept the fact that, you know, stillbirth is at there's a certain incidence in the population. We always have to strive to reduce that as close to zero as we can. And we need to find philanthropic or governmental funding, or wherever we can get some funding for it, to create technologies. We've written several grants and applied to different federal agencies to try and get grants to create a mobile platform that would actually be able to do fetal monitoring in the patient's home. And could we create such a technological innovation that could potentially reduce the incidence of stillbirth and give kind of early alert systems to moms at home, that they don't have to get to the doctor's office or et cetera, that we have to create a mobile, we have to be innovative in our thought process. So that's my plug right there.
Great. Okay, Lou.
I would say acknowledge our children, accept our children, know that we love them and they're a part of our families, and call them by name. It means a lot to us to do that. Thank you.
Eve.
I would have to say, I feel as though if you are someone out there who has struggled with a loss and you don't know where to turn to get connected to help, reach out to me. We at the partnership, we care so much for all of our lost mamas and fathers. And, you know, reach out. We can get you connected to services. We don't want you to have to suffer in silence. If a group is not something that's for you, then we can get you connected to something else. But you know, reach out to me. We want to help you. We care about you, and you know, we'll do whatever we can to help you through this process.
And last but not least, King Cairo.
Hi. So I want to just say a couple things. I would second what Debbie said, to know that you are not alone. I as well am on social media, and it's either Vuan Foster or you can reach out to me on Life After Two Losses. I would also like to touch on the importance of honoring your baby, which I do in so many different ways. And it's important and helpful for other families to do, whether that's having a cupcake on that year anniversary that your baby passed. But don't be afraid to honor your baby, and don't be afraid to do it publicly. So thank you so much for having me.
Absolutely. King Cairo, I think, would like to say something, but the pacifier has the better of him at the moment. Listen, I want to really thank all of our experts for generously taking your time to be here today. In each installment of our Ask the Expert series, we try to shed light on a different aspect of maternal care. And I am so grateful we had the opportunity today to share the effects of pregnancy and infant loss. I am especially grateful to Lou and Debbie and Vuan and Barbara, who shared their experiences with us. Obviously, also Eve and Dr. Westover, can't thank you enough as well. Of all that Nurture NJ seeks to achieve, elevating the voices of our moms is the most important. We've taken to heart the sentiment of not about us without us. So we will continue to keep our mothers front and center with this in mind. And given this month is Pregnancy and Infant Loss Awareness Month, I hope you also will take the time to reach out to the moms in your life and perhaps amplify their stories. Raising awareness of maternal and infant health crisis here is the first step to solving it. Thank you so much to all of you for watching us today and joining us. You can find all of our Ask the Expert series on my Facebook page with interviews across a broad range of experts. So please don't hesitate to use us as a resource as well. Together, we will make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. And thank you all for helping us get one step closer. Thanks, everybody. Bye.